Good morning, everyone. I hope you'll agree with me that that was an incredible opening ceremony last night, and it's going to set the stage for a very exciting 3 days of activities. My name is Mike Clagg, and I'm Dean of the Johns Hopkins Bloomberg School of Public Health. You may be wondering why I'm doing the introduction, given that this is a session of women leaders who are taking on the issues of leadership, access, and equity. The organizers informed me, and by organizers I mean Oying Ramon, that in the interest of gender equity, we needed a token man as part of this session. So that's why I'm here. But all kidding aside, it's a privilege, a pleasure, and an honor to introduce somebody who needs no introduction, especially to our community. As all of us are aware, the world is truly blessed, and we are all inspired that Melinda Gates has taken on this issue with such courage. And this issue has such a profound impact on women, girls, and the well-being of families and children for generations to come. Melinda Gates is co-chair of the Bill and Melinda Gates Foundation. Along with Bill Gates, she shapes and approves the foundation's strategies, reviews results, and sets the overall direction of the organization. And as you know, the mission of the Bill and Melinda Gates Foundation is that we believe every person deserves the chance to live a healthy, productive life. And that's a vision that's very consonant with what we're doing here today. Together, Melinda and Bill meet with grantees and partners to further the foundation's goals of improving equity in the United States and around the world. They use their many public appearances to advocate for the foundation's issues. Last July, Melinda made headlines by spearheading the London Summit on Family Planning with the goal of delivering contraceptives to an additional 120 million women in developing countries by 2020. While involved in all of the organization's endeavors, Melinda has stated that empowering women and girls in developing countries to decide whether and when to have a child is a critical driver of her work at the foundation, since that decision can be the source of transformational improvements in the health and prosperity of families and whole societies. Melinda Gates received a bachelor's degree in computer science and economics from Duke University in 1986 and a master's in business administration from Duke School of Business in 1987. After joining the Microsoft Corporation in 1987, she distinguished herself in business as a leader in the development of many of Microsoft's multimedia products and was appointed as Microsoft's General Manager of Information Products. In 1996, Melinda left the organization and since then has directed her energy toward the nonprofit world. Bill and Melinda Gates live in Medina, Washington, near Seattle. They have 3 children. Ladies and gentlemen, please join me in welcoming Melinda French Gates.
Well, good morning, and thank you for that welcome. It's great to see so many friends out in the room today. I think I should start, though, by saying that we should just take a moment to recognize what's happened in the Philippines, because our hearts go out to our many friends there and the devastation that they're waking up and facing the last few mornings. So I just want to acknowledge that. I want to thank the government of Ethiopia for hosting this conference in this beautiful, amazing facility. And also to the Gates Institute at Johns Hopkins for hosting us all this morning. The first conference in family planning was 4 years ago. The fact that we have 3,000 attendees at this conference shows you, I think, the momentum that's happening in the family planning field, and that's really exciting to see. For me, it's always a pleasure to be in Ethiopia. I've been fortunate enough to travel here actually many times over the last decade. And one of the trips that really stands out for me, though, to Ethiopia was about 5 years ago. I was hosted by a young woman. Her name was Tassan Barani. She was a community health care worker, part of this extraordinarily large health extension network that the government has set up. 15,000 rural health posts, 30,000 health care workers out working in the most remote villages in Ethiopia. And through Tassan's eyes and the work that she and her coworkers are doing, I really got to see what government leadership looks like, and looks like at a large scale. I got to see not only that health extension system, but the individual leadership of these community healthcare workers working with women and men and children in these rural villages. And it's that incredible system that was built out and the commitment to that system that has allowed Ethiopia to reach MDG 4 2 years early. It's really quite remarkable. I'm honored today to address the leaders of our community in family planning, but when I think about what's happened in Ethiopia here for their whole health system, that's the kind of leadership, but when I talk about leadership, that I mean when I talk about family planning. Together, under this banner of FP 2020, we're revitalizing family planning. It is back on the global health agenda, right where it should be. And this goal that we've got to give 120 million women voluntary access by 2020, we're going to get there. When I look out and think about this leadership on large scale, it's the individual contributions that so many of you are already making in your communities, in your countries, that's going to help get us there. We want to make sure that women have the ability to reach their dreams. They have these incredible aspirations for their families, and what I think family planning will allow them to do is to reach those dreams. So today what I'd like to do is tell you 3 stories about leadership in this space of family planning. My first story is about someone I think many of you actually know, and that's Dr. Daff. He's the head of reproductive health in the Senegalese Ministry of Health. My understanding is that one day, not too long ago, a few years ago, Dr. Daff was at his desk. He's not at his desk, I hear very often, because he's quite active, but he's at his desk and he received a phone call, an anonymous phone call from a man from a rural village in the north of Senegal. And what this young man reported was that there were many women in his village who had a desire for family planning, but there were stockouts in their clinic. And so what the women were doing was crossing this river Douai that you see every single day in wooden canoes, and they were going to a town across the river to get contraceptive implants, but they were getting them at exorbitant prices. And Dr. Daff, from what he heard, thought, this is worth investigating, and so he and his staff did investigate. And they found out that it was not just in this one remote rural village that this was happening across rural Senegal. And Dr. Daff thought this is worth doing something about. They came to realize that they had quite a significant supply chain issue going on in Senegal, and so they took about the problem on themselves to learn from the private sector. How was it that the private sector could keep all kinds of goods in stock? And they took a very innovative approach about supply chain management from the private sector to the family planning sector. And the result is that today, all kinds of contraceptives are stocked in clinics, not just in Dakar, but throughout the country of Senegal. And we're already seeing a rise in the modern contraceptive prevalence rate in Senegal. And to me, that's leadership. And that means that Senegalese women can get the family planning tool that they want, a lot more women. My next story is about a remarkable young woman that I met this year in May, actually, at the Women Deliver Conference in Kuala Lumpur. Her name is Nargis Shirazi, and she's a youth advocate from Uganda. Nargis describes her childhood as the perfect childhood. She said, I had these amazing parents who told me I could do anything, and as long as I went and got an education. And she said, my goal was broad. My goal when I entered university was to change the world. But she said, I didn't really know how I was going to change the world. And so she went off to university in Uganda. And as she was there, she noticed that so many young women like her age were dropping out of university because they were getting pregnant. And as she looked around to see who was counseling these young women, she realized that it was really a lot of older people. And she said to herself, Well, why is that? Aren't we the youth? Aren't we the next generation? I think we're the ones with the big ideas. And what she realized was that she wanted to lift her voice and to help communities discuss the important issues of family planning. Now, Nargis is incredibly creative and talented. And what she did was she designed a play. And in her play about family planning, she cast a role of a man who was pregnant that you see here. And what she said she learned by doing that was that the interaction between the cast and the audience turning the tables to have a man who was pregnant totally changed the conversation. So she not only created this play, she got it performed at the Ugandan National Theater, and it became a hit. And she decided that the power of a play like that needed to be taken to multiple communities across Uganda. So she started a community project called Woman to Woman. And what that helps youth do now is to write their own plays and perform them in their own local villages. And what she saw through drama was that it gave young people a voice in deciding what they wanted their future society to look like in Uganda. Now, I've met a lot of young advocates, young men and women, and I agree with Nargis. Why is it that the old people, people like me, are talking about family planning? Why isn't it our youth? They're the ones that have the big ideas. We need to help them raise their voices. My final story is about a woman that I met a couple of years ago in Korogocho, which is a slum outside of Nairobi. I met her at a mother's group, and her story has been deeply meaningful to me as we've gone through this work in the family planning community. I won't disclose this woman's name because of her sake of anonymity, which she needs and her safety, but she's 31. She has 5 children, 3 of her own, and 2 of them are her stepchildren, and she's the main breadwinner for her family. Her husband is a day laborer, but he doesn't bring in a lot of money, and so what she does is she buys and sells t-shirts and underwear in the local market. And as she says, on a good day, her children get both lunch and dinner. And on a day when business is slow, her children get just dinner. She realized to care for the 5 children that she had, she needed to space the birth of her next child. So she went down to the local clinic and she chose to get a contraceptive implant in her arm. But her husband discovered it, and he was not happy about it, and he beat her up, which she said was something that happened on a pretty regular occurrence in her home. He marched her down to the local family planning clinic where she'd gotten this implant, and he demanded of the nurses that they take it out of her arm. And that's when this woman decided to raise her voice. With the help of the nurses at this clinic, she had a very difficult conversation with her husband that ultimately ended up in the fact that she kept the implant in her arm. Her insistence on doing that enabled her family to have, as she described it, a better future. We're here, we're gathered, because we want for all women what this woman wanted for herself and for her family: hope, dignity, joy, and a better future. Contraceptives are on a long link, they're a link on a long chain that give people an opportunity for a better life. That long chain includes safe motherhood, healthy newborns, vaccinated children, and the list goes on. Our goal is bold, absolutely bold, but it's achievable. It's going to require, though, long-term leadership. Not just leadership on days like today when we're all gathered and we can talk about the momentum, we can talk about what's going on, we can see momentum, but days when things get tough, when our attention wanders, or when the global health community attention wanders. Those are the days that we have to stay at this. My pledge to you is that our foundation is committed to this. We are committed to this for a long time, until we assume Until we get there, until we get these 120 million women access to voluntary contraceptives, and quite frankly, long beyond that, because there are another 100 million women coming behind them. And our plan is to follow you all, to follow the leaders who have the evidence and are making progress in your own countries. We need leaders like Tassan, making health care better for thousands in their communities all across their countries. We need leaders like Dr. Daff, who listen and move the machinery of government on behalf of other people. And we need leaders like Nargis, who lift their voices to help their communities lift their collective voices. Most of all, we need leaders like that brave mother that I met in Korogocho. Millions of women are fighting. Courageous women who are fighting for themselves and their families because they know for their families it's a matter of life versus death. Let's make sure that their courage counts. Let's fight with them for as hard as we can and for as long as it takes. Thank you.
That was great. Thank you. That was good. So your seat's right down there. Thank you, Melinda, for the inspiration. I think Melinda Gates puts a personal face on the issues of family planning better than anyone I know, and it's really inspiring. So before I leave, let me introduce the chair of the next panel, which is going to discuss the theme of this session. She will, in turn, introduce the distinguished members of the panel. Since 2012, Professor Marlene Temmerman has been the director of the Department of Reproductive Health and Research and of RHP, UNDP, UNFPA, UNICEF, WHO, World Bank Special Program of Research, Development, and Research Training in Human Reproduction at the World Health Organization. That's a very acronym-dense title. HRP is the main instrument within the United Nations system for research in human reproduction and sexual and reproductive health, bringing together policymakers and programmers, scientists, healthcare providers, clinicians, consumers, and community representatives to identify and address priorities for research to improve sexual and reproductive health. She is also the chair of the Reproductive Health Supplies Coalition. Professor Temmerman is also a full professor in OBGYN at the Ghent University in Belgium, currently on leave of absence. She is the founding director of the International Center for Reproductive Health and has authored over 400 papers and books and supervised master's and PhD students in international health in many parts of the world. In addition to all that, in 2007, she was elected as a senator in the Belgian Parliament, where she was a member of the Commission on Social Affairs and the Commission on Foreign Affairs. In that capacity, she was also a member of the European Parliamentary Forum and chair of the HIV/AIDS Advisory Group of the Inter-Parliamentary Union. She has served as a member of the IERG, the Independent Expert Review Group, until 2012. Professor Temmerman, please join me on stage.
Thank you for this lengthy introduction. Good morning to all of you. It's a pleasure for me and an honor to be here, and especially also to take the floor here after one of the great leaders. Belinda has spoken to us about leadership in health and family planning. Thank you. And it's my pleasure now to invite the panelists to the stage. Please come up, all of you, so that I can start the introductions and start the discussion of the panel. So it's an honor for me to introduce as the first member of our panel, Her Excellency Roman Tesfaye, the First Lady of the Federal Democratic Republic of Ethiopia. Her Excellency, Mrs. Roman Tesfaye, received, I just go to give a little bit of an introduction and a history and then invite her to her speech, but because her CV is indeed very impressive. She received her bachelor degree in economics in '87 from Addis Ababa University, where she also met her husband, Prime Minister Haile Mariam Desalegn. She then earned a master in economics from Aligarh Muslim University in India in 1998, and a master in organizational leadership from Azusa Pacific University in California in 2009. Her Excellency, Mrs. Roman's professional career included her service in many organizations. In 1999, she became a lecturer in economics at Arba Minch University here in Ethiopia. And she also demonstrated unparalleled leadership skills in a number of organizations and committees. She was the director of Monitoring, Research and Advisory Directorate at the Ethiopian Human Rights Commission. She also headed the Department of Children, Women and Disabled Persons within the Commission successfully, and Mrs. Roman spearheaded a number of initiatives in the Ministry of Women's Affairs while she was the head of the Department of Women's Policies and Strategies. She has a long list of responsibilities, but besides this, she also has served in as an active member of Southern Regional State Parliament for 2 terms. She is currently working at the UNDP as well as assuming the official function of the First Lady of the Federal Democratic Republic of Ethiopia. She is very engaged. I met her earlier this year in Mozambique, where she was part of the First Lady's initiatives, who is bringing together a number of African First Ladies who are engaged in improving women's health, reproductive health, including cervical cancer. Her Excellency, Mrs. Roman, has taken various tailored trainings, amongst others, on child-friendly school management and educational leadership at home and abroad. She has been advocating for the proliferation of child-friendly schools in Addis Ababa. And she is a mother of 3 daughters. She, as First Lady, is interested working on issues such as women's economic empowerment, education, maternal health, and well-being of children. Her Excellency, Mrs. Roman, wants to address the audience and address a few words, give a speech. The floor is yours.
Thank you, Professor. And thank you all the organizers of this conference for giving us this chance. I would like to extend my appreciation for all, and also for the beloved youth amongst us who are ready to champion the family planning across Africa and the world. I'm really honored to be a speaker at this marvelous international conference on family planning today. I would like to welcome you all on behalf of the people and the government of Ethiopia. This conference is an important opportunity to expand and improve access to family planning worldwide and to generate new commitments to the family planning agenda. I'm also particularly happy for Ethiopia was chosen to host this event because of the outstanding performance in providing voluntary family planning and reproductive health services to millions of women. I'm delighted to comment on that and join this moment of celebration. I would also like to commend you all for your efforts to maintain the momentum struck at the groundbreaking Family Planning Summit in London in July last year. I believe that this conference also creates an opportunity to further recommit ourselves on the pledges made on London Summit. honorable guests, ladies and gentlemen. Family planning is the finest option to improve women's and children's lives and attain the health-related Millennium Development Goals. In addition to improving family health, family planning services create opportunity for women to actively participate in socio-economic spheres. As women's participation in productivity increases, their economic and decision-making power also gets stronger. Apart from this health and economic benefits, family planning is considered as one of the basic rights of women, as clearly stipulated in our Constitution. Women will be able to avoid unwanted pregnancy, and when they understand how many children and in what intervals they would like to deliver and using family planning. The risk of a girl under the age of 19 years dying due to pregnancy is twice that of women over 20 years. Many of these girls are married by 16 years of age and are expected to have children straight away, putting them at a high risk of maternal health or maternity-associated disability like fistula. That's why increasing the age of first pregnancy and increasing the use of family planning are among our major objectives when providing youth-friendly family planning services. Honorable guests, ladies and gentlemen, we all agree on the importance of empowering women, but do we agree on what would be the most effective method to achieve it? How should we coordinate and lead such a big initiative? Firstly, empowerment is so complex concept that its implementation has also become difficult. By empowerment, we not only mean women's sense of self-worth, but also women's rights to have and determine choices, to have access to opportunities and resources, and to influence the direction of social change. In family planning, for example, they should be informed and have the right to choose when and which contraceptive method to use. Secondly, when we speak about empowerment, we should bear in mind that the economic aspect plays an essential role. We need to focus on women's economic empowerment. Women have to be enabled to generate their own incomes in order to be economically independent from their male partners and to access the legal services, education, opportunities, and self-fulfillment. The more economic empowered the women are, the more able they will be to plan their future, their family's life together with their partners, to avoid abortions and psychological disorders, and to build a happy family and society. I firmly believe that women leaders at all levels play an indispensable role in ensuring full access to family planning and reproductive health services. Women parliamentarians at the national level should initiate new bills and policies and get adequate resources allocated that are aimed at ensuring full access to family planning services and spearhead the process. Women who hold senior leadership positions in public and private entities should also play an exemplary role and speak up to promote access to family planning services. As a role model to millions of women and girls, women leaders can also help women and girls to make informed choice. They have to play a leading role in combating the flawed attitude of the society towards family planning services and facilities. I think all this is witnessed in our country experience where women played a great role in achieving these marvelous achievements. Honorable guests, ladies and gentlemen, there are a number of reasons contributing for the progress Ethiopia has made on family planning. The presence of appropriate national policies, effective awareness-raising campaigns, and delivery of contraceptives to people in need, irrespective of their capacity to pay for the service. The work of dedicated health workers, in particular health extension workers, which Melinda has already gave a brave explanation on it, and the involvement of a wide range of stakeholders from the private sector, civil society, and development partners being the key factors. This progress is very encouraging and has significantly influenced the lives of millions of women and men in this country. Women are now more informed and more aware about their rights and can decide about their future more freely. Unfortunately, in particular in rural areas, there are still women who do not benefit from a range of reproductive health services, owing to the lack of proper facilities and services, owing to illiteracy, flawed attitude of the society towards the use of contraceptives, and harmful traditional practices. Every single day, some of them even die when they give life. Some of them do not have the power to make decisions on their own, let alone to decide on the family planning methods they would prefer to use. In order to change this reality, I am sure all of us would agree that their empowerment is crucial. We still have a long way to go in terms of achieving national and global targets, and we are expected to do more to materialize the set goals. Fulfilling the high unmet need among married women will have a critical contribution in the promotion of mothers' health, reducing maternal mortality, as well as in plummeting treatment-related costs resulting from pregnancy and delivery complications. In addition to the encouraging activities being carried out in the health sector, a great effort and collaboration is needed to solve reproductive health problems, especially among girls as well. The issues of young people need to be addressed with utmost urgency. We need to reach sections of adolescents and youth in their specific contexts. We need to increase investment on family planning programs, education, employment, and empowerment of youth and women for Ethiopia to reap the benefits of the demographic transition. Honorable guests, ladies and gentlemen, my office is diligently working to establish a network of actors on women economic empowerment in this country. We are working to contribute to efficient use of resources in Ethiopia and create synergies among all stakeholders to implement nationwide programs rather than small and fragmented interventions. We are firmly committed to work on improving the health, education, and economic empowerment of Ethiopian women, since they are the pillar of this country. Finally, I am sure that this ambitious conference is going to be a wonderful opportunity to join our efforts to design and implement the most effective strategies to improve family planning in the world. If we can keep in mind that the ultimate goal of all our interventions should be the empowerment of women, I am sure we will truly achieve full choice and full access to family planning services. I would like to conclude by reminding you all to continue our efforts to enrich women and the youth, enable them reach their goals, and keep themselves from reproductive and other related health problems, and create a better society. I thank you all.
Thank you very much, Your Excellency, for this excellent speech calling for more leadership for women in public, private, political venues, wherever they are. Thank you so much. I'm going to introduce now the other panel members, and at my left side, Mrs. Theo Soa is the Chief Executive Officer of the African Women's Development Fund. She has previously worked as an independent advisor and consultant, specializing in international social development with an emphasis on women and children's rights and protection issues. Theo serves as a board member on a number of very important African and international organizations, and there's a whole list, but she deleted all of them because it's too long and too many, and she said, give as an example the Graça Machel Trust. She was honored as a Commander of the Order of the British Empire in 2010. Theo has also been a contributing editor of the book The Impact of War on children and a co-author of a book on group work with young people. And most recently, she was a contributing author and co-editor of the Harvard Law School UNICEF Innocenti book, Children and Transitional Justice. Theo. So I will first continue with the introduction of the panel members. And it's my pleasure now to introduce Mrs. Ellen Starbird, Director of the Office of Population and Reproductive Health at USAID. Ellen Starbird is the Director of the Office of Population and Reproductive Health, and she has worked for USAID for 23 years. She was a Deputy Director of PRH for 7 years before becoming the Office Director in April 2013. Previously, she was the Chief of the Policy, Evaluation and Communication Division in the same office. Before joining USAID, Ellen worked for 3 years at the RAND Corporation, principally on the Malaysian Family Life Survey. She has an MA in Development Economics from the Fletcher School of Law and Diplomacy. Ellen has been engaged in managing all aspects of USAID's family planning and reproductive health portfolio. Let's give her a clap. It's also my pleasure to introduce Ms. Carol Larsson, who is the President and Chief Executive Director of the David and Lucille Packard Foundation. Carol is the President and the CEO and of the foundation, that is a family foundation based in Northern California, that has been a long-time funder of population and reproductive health. The foundation was created out of the business philosophy and personal values of David and Lucille, who helped found one of the world's leading technology companies, Hewlett-Packard. Today, their children and grandchildren continue to help to guide the work of the foundation. Carol has been the president and CEO since 2004. She joined the foundation in 1989 to work in the foundation's grant-making areas on children and went on to become director of programs, then vice president of the organization in 2000. Prior to joining the foundation, Carol was a partner in a law firm specializing in civil litigation. And she is a graduate of the Stanford University and Yale University Law School and currently serves on the board of the Council of Foundations, the largest membership organization for foundations in the United States. Welcome. And unfortunately, because we were planned to have another member on our panel, and unfortunately, Honorable Janet Garin, Undersecretary for Women, Children and Family Health in the Philippines, could not be with us here today, since the Minister of Health asked her to be in charge of Tacloban City, which is the part that is most hit and most damaged by the devastating typhoon. All our thoughts to her and to the Philippine population. But thoughts are not enough here. And I think this is really a good opportunity for all of us here at the conference to maybe concretely explore what we can do and how we can help the Philippine people in this extremely difficult moment. We can continue and think about it. So thank you very much for giving me the opportunity to introduce these great ladies in my panel. And I'm very honored to be here and to moderate this high-level meeting to discuss and collect experiences on how equity can be achieved through women already having a leadership role and what needs to be done to empower other women to become leaders. And I thank the organizers as well as the panelists and the distinguished guests of this meeting for joining us in this discussion. I have a couple of minutes for a very personal story, and I would like to introduce to the panel the story of a young girl that I met in 1987 in Kenya and who was very influential in my personal life. She was 14 years old. I was 34. I have to move a little bit away from the microphone. Okay. So she was 14 years old. I was 34 when we met in 1987 in Pumwani Maternity Hospital in Nairobi, the largest maternity hospital in East Africa, with about 80 deliveries a day. I was working there as an obstetrician gynecologist and a researcher at the University of Nairobi. And the research question at that time, we are mid-80s, was, is there HIV in Africa? Can women be infected? And if yes, can it have an impact on pregnancy? She was a young girl, turned pregnant, who was rushed into labor ward. She was silent. She did not move, she did not cry anymore, which is very worrisome because dead moms don't cry. Her child had died already, and the young girl was barely alive. And she died shortly afterwards in my arms of a ruptured uterus from obstructed labor. Later, we discovered that she was 14 years old and she was the oldest of 6 siblings. She had lived with her family and her parents in rural Kenya, but her parents died of AIDS. And there was no one to take care anymore. Even the extended family structure could not take care of the young children who then went to Nairobi to look for jobs, to look for ways of surviving. And her story is a testimony of lack of empowerment of girls and a violation of girls' rights. She had to look after the younger siblings. She could not attend school. She was very vulnerable. No way to say no to sex. No access to contraceptives. She became pregnant. She did not attend antenatal care. She was in labor for 3 days without care, without support. And when she couldn't bear the suffering anymore, she went out, collapsed. She was brought into the maternity by some people and died. She was my first maternal death. Unfortunately, not the last one. But this girl, 14 years old, I will never forget her because I was pregnant at that time and very sensitive to the suffering of so many women and girls. She changed the course of my life. Unfortunately, I could not save hers. And I've seen so many women dying, so many girls, of preventable problems in pregnancy, such as hemorrhage, hypertension, infections, HIV, that with good standard care could be avoided. I've seen so many girls, young girls, dying of unsafe abortion. And I think this is all about why we are here together today, this conference, while we are here fighting for rights, for empowerment, for right access to education, for family planning, and also for contraceptives for young girls, because they don't think of planning their family. They don't want to get pregnant. They want to avoid an unplanned pregnancy. So I'm glad to have had the opportunity along my career to work in different areas and assuming different roles, including being a medical doctor, gynecologist, obstetrician for many years. I have engaged in politics and became a senator. I worked extensively as a researcher and a writer, and ultimately assuming my current role as director in the Department of Reproductive Health and Research in WHO. In these different roles, I experienced how many challenges a woman needs to face to do what exactly she wants to do and to become a leader. And this is a sense of leadership. The leitmotif in my career and the different shapes it assumed along the path has been my interest, and I would say my passion, in making it possible for women and girls to have access to reproductive and sexual health, education, services, and care, the right to decide on their reproductive and sexual lives, the right to decide when they want to have sex, with whom, and when they want to have children. This includes the right not to be pregnant, the right to have access to education, the right to get empowered, to have equal rights. Being a leader means to me being in a position to support other women in getting empowered, to fully enjoying their rights and galvanizing equity advancements. I'm going to stop here with my introduction and now to maybe ask some questions to the members of the panel. Thank you. Thank you. And I first have a question for Her Excellency Roman, the First Lady of Ethiopia. And as a professional, you have worked on issues related to women, and as a First Lady of Ethiopia, I would like you to share your perspective and your experience on how Ethiopia has been successful in making strides towards achieving equity in access to contraceptive and family planning services.
Thank you, Merlin. If you ask me to tell all what is being done in Ethiopia, it's very long story, but I will try to focus. The government of Ethiopia realized the severity of the problem. Like you said, the early marriage is, for example, very serious problem in our most part of the country, and also other harmful traditional practices were very rampant, which affected the lives of women. And in some areas, for example, women even they are not allowed to stay at the main house when they are giving birth to a child. They are supposed to have their own little shed to stay away from the family and to face all the pain and the process alone. So that is one aspect, and the other is in our constitution as well as in other policies and strategies. It's clearly specified that if we do not address the women issue, if we do not bring them at all levels to play their roles, all the ambition to be a middle-income country it will be futile exercise. So it's imperative. We understood that it's imperative to empower and to make available all these reproductive health services to women of Ethiopia. So as I have already highlighted at my speech, empowerment is very complicated and it has so many elements within it. One of it is education, as we all agree. And if girls need to be educated, if they need to attend schools, they have to be protected from an unwanted pregnancy, and so we found it very reasonable and it's must to have this service in place. And the expansion of the infrastructure, health infrastructure across the country was the key factor. We have almost the necessary health centers across the country, and the health posts which are linked to the health centers, and also district hospitals are all built and in place to give the service for the women, to deliver the women reproductive health services. So together, this is one aspect. If we don't have the infrastructure, if we don't have the physical facility, we cannot provide these all services. And as this has to be complemented with the right personnel in place, as we have started to learn from yesterday, the health extension workers played a very significant role in bringing up these women to the facilities we have at the health posts and health centers. So they outreach to each and every households, to each and every girls and women at their home. We have the 16 packages, what we call, I think nowadays the packages are even getting larger. So they educate these women and girls to get prevented from preventable diseases and to get the services at the health centers and at health posts. So this has helped, or it is a basic for all the services, family planning services, what we are talking about. So I think this is the main and core issue which I can oversight. Thank you very much.
Thank you, Roman. Now a question for Theo. Thank you. You are a very active advocate for women's rights and a very active member of the civil society. Now, how do you think we can bring the voices of women, specifically those who are not here today, how can we bring them to the forefront to reach more equity?
Okay. Does that? Hello. It is on. Okay.
Why don't you?
Okay.
Why don't you?
Well, can you hear now? Oh, yes, I can hear that. Okay, so I'm going to answer the question slightly indirectly, because I think it's not just about bringing the voices of women into these settings and into rooms. It's about how you make sure that women's viewpoints, women's knowledge, women's experiences are integrated in everything that we do, not in our policy, in our practice, in our politics. And one of the things I've really noticed so far about this year's conference, and which I think is really delightful, is that the conversation has changed. Not entirely, but the conversation has definitely moved on. And when I compare it even to the Family Planning Summit in London last year, where when women's rights were mentioned, it was almost novel, at this meeting so far, there have been a lot of people talking about women's rights, talking about health rights, talking about inclusion, not just of women, but of young people and of people whose voices that we don't normally hear. And also people have been talking about family planning in a slightly different way. People have been talking about integration and understanding that if we look at family planning as a silo effort, we are not going to get very far. And if we haven't learned that from 5, 6, 7 decades of development work, that working in silos doesn't get us very far, then we're actually being quite obtuse. So I'm really delighted that people are talking about women's rights. I'm really delighted that people are talking about women's voices and women's leadership. What I'm worried about is that if it stops there. Because if we end up with a rhetoric around women's voices and women's rights without the action, without it translating into programming, then we're being really insulting to the millions of women who are dying while we talk. If we end up with rhetoric instead of practice, then we're undermining the very goals that we all think that we want to achieve. So in talking about women's rights and voices, I just wanted to say that when it works, when we move beyond the rhetoric, then we see the examples like that we've already heard about around Ethiopia and what Ethiopia has been able to do in increasing access and use, in cutting down the numbers of maternal of deaths from in terms of mortality. And we've already heard that a lot of that is because Ethiopia had women at the center of what it was doing. Yes, there was government prioritization of the issue, which is really important. Yes, there was policy change. Yes, there was a really strong attempt and an ongoing attempt to make sure that supply chains and service lines were active. But at the heart of all of that were women. The women health extension workers, not just were service deliverers, they were speaking to women, learning what women's fears were, what their hopes were, what their knowledge gaps were, and then they brought that knowledge back. The people at the center who were making policy decisions didn't just listen, they heard. So there was an integration. So we had real women's leadership that went all the way along a chain and has come all the way through into this room here. And that's what we need to do if we really want different women's voices and a variety of women's voices and real women's leadership. Because when that doesn't happen, when we have the reverse, we get the rhetoric. And when we get the rhetoric without action, we get window dressing and we get marginalization, and we don't achieve what we need to achieve. So very quickly to answer your question, in terms of the diversity around voices, I think that all of us who are sitting in this room need to challenge ourselves to do things differently. When, as a family planning and a reproductive health family, as it were, we come together and we start addressing these issues, how do we make sure that when we say we have women civil society leaders in our conversations, that we have them there in a real way, that we actually listen to what they say rather than marginalizing their voices? If we bring women to these forums and continue to act as usual, then it is a waste of time, and that is not around women's rights, it is not about women's leadership, and it's not about actually using the experience and the wisdom of women. So I would like to challenge all of us here. As governments, how do we make sure that when we are talking about political inclusion, we are talking about political inclusion with a small p, so that we bring in all of our women who are leaders within small communities, whether rural or urban, leaders in the economic sphere, leader in the scientific sphere. How do we, as governments and as nations, really bring in our women's leadership in our own countries before we even start thinking about how that leadership extends externally? We have seen it done. We know it can be done. We just need to have the political will and the actions to make it happen across the board and not just in small silos. As civil society, how do we challenge ourselves to really have women's voices there? I'm part of the women's rights movement. I know how scared many of us were to become in any way involved with family planning or reproductive health work, because for so long it had been associated with actually an undermining of women's rights. Well, we also know as women's rights workers that family planning and reproductive health actually are a key to unlocking all kinds of power and potential for women. And it's a key to unlocking protections for women, to unlocking protections for all of our communities. So we have to step outside our comfort zone. We have to come into these circles and make sure that all of the decisions, the declarations that came out of Cairo, that came out of Beijing, that came from Dakar, that we bring those into this conversation and hold people to that line. And that means that the people who are here, who want to say about women's voices, actually listen to women's rights activists when they come and they say, we want to be part of the monitoring as well as the service delivery, etc. I think when it comes to donors, again, look at how you fund some of these things. Challenge ourselves. The next time you want to invite women leaders, say to us, don't just come yourself, bring a woman who never gets access to this kind of space. Bring a young person, a young woman who you want to mentor into being able to interact in these spaces, and then fund in a way that makes that possible. Think outside the box. When you put out your calls for proposals, if it goes to the usual suspects, nothing changes. Use networks, use unusual networks. All of us should actually try and step outside of some of our comfort zones. When we do that, we get real change. And the thing is, we have to push, we have to do more. Yes, the conversation's changed. Yes, we are seeing improvements in terms of access, in terms of use. We're even seeing improvements in areas in terms of maternal mortality. But it's not enough. We cannot be complacent, because if we are complacent, we do not achieve the things that we need to achieve in the time that we need to achieve them. Women are dying, our communities are suffering, and they do not need to. We know how we can change this. And when it comes to women's leadership, women have been leaders in Africa and in other parts of the world for generations. Let's not pretend that's not true. Let's just make sure that we know how to use that leadership and that we make sure that that leadership is not marginalized.
Thank you so much, Theo, for your passionate call to action beyond rhetoric and to make us all accountable, and also for bringing the unfinished action plan of Cairo on the table. This is crucial, I think. Now my question, the next question is for Ellen. Ellen, you are now more than 20 years working with USAID. It's the largest bilateral donor in family planning, I think. What can you bring us from your experience to bring more equity in the family planning and contraceptive service delivery?
Thank you. First, I want to say what an honor it is for me to be here on this panel with the accomplished and successful women up here on the stage, and also with all of you who share a commitment to full access and full choice. USAID has been a leader in international family planning assistance for almost 50 years. The right of women and girls to choose the number, timing, and spacing of their children is a guiding principle of USAID's Family Planning and Reproductive Health Program, and has been from the very beginning. But that right's only realized when women can act on that choice, and that has two parts: knowing that you have a choice and the freedom to make it, and the availability of high-quality, affordable, and accessible information and services and contraceptives in order to make an informed choice from a broad range of family planning options. Over our almost 5 decades of work in family planning and reproductive health, USAID's worked on both of these fronts. Our work on gender equity, which is fundamental to women and girls having choices in life, ranges from working to end child marriage in Nepal and elsewhere so that girls can stay in school and postpone childbearing, to addressing harmful gender norms and cultural practices, such as female genital cutting and gender-based violence worldwide, to building women's leadership and business skills as community health workers or private midwives or secretaries of health. Some of our earliest work to provide equity and access was the introduction of doorstep delivery of family planning in Bangladesh, which not only delivered services to women who couldn't leave their homes, but gave women a new and legitimate role in community as female health workers. On the supply side, USAID's been involved in the development and or introduction of practically every modern contraceptive in the market today. And we specifically focus on the development of contraceptives and multi-purpose methods that can be used in low-resource settings, thinking both about the cost of the method itself and how it gets delivered. Our current contraceptive research portfolio includes a one-size-fits-most diaphragm and a 1-year, user-controlled, reusable vaginal ring, among others. And if the past is any guide, women and girls in the Global South won't be the only beneficiaries of these investments. Women and girls in the Global North will use these methods too. We're also involved in piloting Depo and Uniject, known as Cyanopress, which, if it proves affordable, holds the promise of greatly expanding community-based delivery of this popular method. And we're proud to be a supporting party in the historic public-private partnership that's lowered the price of implants by 50%. Another way that we prioritize equity and access is by focusing our resources on countries in Africa and Asia with the highest unmet need for family planning, almost tripling our resource allocation to these countries over the past decade. Furthermore, within these countries, we're looking at whether our programs are reaching women and girls in the lowest 2 quintiles. Task shifting, mobile outreach, dedicated providers for long-acting reversible contraception, and integrated community-based service delivery are all expanding the availability and accessibility of a broader range of family planning options to women and communities that have been underserved. We're committed to partnerships like the Ouagadougou Partnership that's focused on West Africa, the Alliance for Reproductive, Maternal, and Newborn Health, and Family Planning 2020, as ways to make our dollars stretch farther and to share and diffuse best practices with respect to equity and access. Women who are able to space their pregnancy at healthy intervals and stop childbearing when they've reached their desired family size are at lower risk of maternal mortality simply by not getting pregnant as often, and they reap health benefits for themselves and their children. Expanding voluntary family planning programs to serve the 220 million women with a current unmet need for family planning could reduce maternal deaths by 30% and save the lives of more than 1.6 million children under 5 each year. Lower mortality and lower fertility create the age structure changes that, when accompanied by supportive economic and social policies and investments, can lead to rapid economic growth. As Melinda Gates noted, family planning is a link in a chain that leads to development. The assistant administrator in the Bureau for Global Health, where I work at USAID, talks about a grand convergence, by which he means that we, the global community, have the historic opportunity to accelerate progress in maternal and child mortality and achieve a world within a generation where maternal and child mortality rates in the developing world look like those in the developed world today. We must strive for the same global equity in family planning and reproductive health. Women and girls in the developing world have the same right to make choices about their fertility and reproductive lives as we do in the developed world. And they must have the same ability to make the same choices that we can make. Thank you.
Much, Ellen. My next question is for Carol. Carol, as a leading grantor in population and reproductive health, why has it been critical for the David and Lucille Packard Foundation to support family planning services and products? And how has this support aligned with other important areas such as quality of care and youth?
Thank you very much. It's my great pleasure to be here this morning. Thank you, Melinda Gates, for your wonderful remarks, and thank you, Her Excellency, for being here, and distinguished panelists. The David and Lucille Packard Foundation is going to celebrate its 50th year next year. And the theme of this panel is about women in leadership. And I do want to tell you that back in 1964, as often happens in the founding days of foundations, David and Lucille had their first board meeting sitting around their dining room table. And one of their first checks at that board meeting was to Planned Parenthood. For 50 years, they completely believed that access to family planning, access to the tools and information to be able to plan your families, space your children, were critical links, as several have referred to this morning, to better futures for all people, men and for women. I think that leadership matters for women, and it matters at the governing table. At the Packard Foundation right now, we have 15 board members, 9 are women. And also in the family representation, we have 3 daughters of David and Lucille who have been on the board for many years and have carried this commitment of their parents throughout. And now we have a couple of grandchildren of David and Lucille also who are women and carrying forward this commitment as well. That's happening across our world as women are in positions with their family foundations, political leadership, nonprofit organizations, and they're often the ones to focus on the importance of reproductive health and the importance of family planning. One of the things, though, that if Lucille were here today, sitting with me or in my place, that she would say is what really matters is acknowledging our reliance on and celebrating the individual leadership of each of you. As I look out in this audience, I've only been involved in this field for 25 years, but as I look out in the audience, I see so many faces of people from the United States, from other countries around the world, of people who have been providing their personal, individual leadership on these issues for decades. We're all so happy to be here with 3,500 people, but as the stories that Melinda related to us and several of our panelists have, some of the real courage happens in groups of 2, a man and a woman, in groups of 3, a young woman to her peers, in groups of 35, where it wasn't popular to talk about family planning, in groups of 350 or now 3,500. These aren't often easy issues, and I want you to look to each other and thank each other for your leadership. I do want to mention one name in this event, and it's probably a little bit unusual, but the Packard Foundation has been very grateful to have had the guidance and contribution of the leader of the Gates Institute for Population and Reproductive Health, Amy Choi. It's my understanding that Amy was the moving force for the first of these conferences, and she'll be stepping down from her position of leadership of that institute this year. And as I had conversations throughout the days that I've been here, I know Amy's influence and in the capacity building efforts she's been committed to for decades is felt throughout the hall. So I know we're running a little bit short on time, but I did want to pick up on your question to me, which was not only about the focus on access to services and information for family planning and how important that's been to the Packard Foundation, but also now a focus on quality and youth. And that ties into the theme of this panel. And that's that now as we move forward with this revitalized family planning agenda with a group of 3,500 people with Family Planning 2020, it's going to be quality of how we do that that will make sure that we have sustained impact. And by quality, we believe that, as everyone here has expressed, that it means engaging in a meaningful way women's voices, women at all levels, that we want to create environments where women feel comfortable to seek these services. We want to meet women where they are in life, respect their autonomy and their decision making. So we, going forward, working in Ethiopia and elsewhere, will focus not only on quality, but on youth's voices, and women and their leadership are going to be critical components of that. So let me just end by saying, with a little bit of a personal note, I was a little hesitant to do this, but I bet you there are a lot of women in this audience who have spent decades juggling careers and being moms. And so I have 2 daughters, and for each of them, for their 13th birthday present, I brought them with me on a business trip to Ethiopia. They're now, yeah. So this was my gift to them as they became of age. And so they're now 22 and 18. And when my now 18-year-old was 13, we were here at a conference, and it was I think it was the leader of the YWCA who organized a panel of young girls and young Ethiopian women to talk about their life experiences. And at that last minute, they turned to my 13-year-old daughter and said, "You want to sit up there with them and talk?" So there she sat, and she was like about the 7th to be called on after hearing these incredibly heartbreaking as well as hopeful stories about what these girls had experienced from rural areas, students at Addis Ababa University, just a whole range of experiences, and often very, very difficult. And I thought, what in the world is my daughter going to say, you know? And she said that she had been really moved by hearing this, and she realized that her life was so different, but that also there were some things that were really in common. And that's that men needed to learn to respect women, boys needed to respect girls, that girls and boys and men and women needed to have equal places in shaping their futures. And she just didn't understand why we couldn't get to that point. And so I just want to end by saying that while I know in my own life and in the Packard Foundation's life, Packard family's life, they've been different, but there's this common strand. And that common strand, I'll go back to Melinda's opening words, that it brings about a future that's one full of dignity, joy, and a better future for all of us. And we're united by that hope. So thank you very much.
Thank you, Carol, for also contributing and for focusing on youth. I think that's crucial here. Now, the next question that we had prepared for the panel members is even maybe more interesting now, and is how do you think that female leadership can contribute to equity. But time is not on our side. We have to stop. But the panel members, of course, they have their ideas, they have their views, they have prepared their contributions. So please feel free to talk to them.